1 million people are diagnosed with liver cancer every year. Do you know how to recognize the warning signs and symptoms of liver cancer? This figure of nearly 1 million people is from 2022. Nowadays, the expectation is that this number is even higher. So it's possible that we've already surpassed 1 million new cases of liver cancer. And I'm going to tell you why this number is increasing, how to prevent it, and whether it's even possible to prevent liver cancer. What causes it? What are the risk factors? And also the 11 signs and symptoms. Why? If you catch liver cancer at an earlier stage, your chances of a cure, your prognosis, are much better. The chance of a cure is much higher, so pay close attention to these signs and symptoms. Sign number one. To start off, I picked a really strange and curious sign, which is pain in your right shoulder. Why might you have pain in your right shoulder? Why is that? Is it a warning sign that your liver might have a problem? Because if you have liver cancer, there could be a nodule that's growing, a mass that's getting bigger, a tumor that's developing in your liver. And the liver can also have a condition we call cirrhosis. When the liver gradually loses its vital function, that is also a major risk factor for eventually developing chronic liver cancer. This can affect the diaphragm, and that can then cause pain in your right shoulder. Did you know that? Probably not. It's a pretty strange sign, but it's important to check the liver in these cases. The second sign, and this one is much more common, is a warning sign: loss of appetite. Why is that? Cancer can produce substances that make you feel more nauseous, take away your appetite, and also just by growing and consuming nutrients, for example. It can cause loss of appetite and, as a result, weight loss. So, loss of appetite can be a bit more subjective, but weight loss is not. And it's that kind of weight loss where you haven't made any changes. You didn't start any new physical activity, you didn't change anything in your diet, and you're losing weight for no apparent reason. When is this weight loss concerning? And when should you look into possible causes, like liver cancer? There's a specific number: a weight loss of 10% or more over a period of 6 months or less. That's a sign that something is wrong, and yes, we need to look into it. There are other diseases that can also cause unintentional weight loss, like diabetes or high blood sugar levels. When blood sugar levels are very high, the body also experiences reduced insulin action, or in the case of type 1 diabetes, you don't have insulin at all. As a result, blood sugar rises very quickly, which leads to weight loss because the main anabolic hormone, the strongest one we have, is insulin. And this is a very serious condition. So, high blood sugar levels and weight loss are an emergency. You need to be very alert because you could develop a serious complication like diabetic ketoacidosis, which also has a high mortality rate. And another condition, since we're talking about weight loss, is thyroid disorders, especially hyperthyroidism, which is an excess of thyroid hormones. It can also be serious, potentially causing a significant increase in blood pressure and speeding up your heart rate. You also need to get tested as soon as possible to find out what's going on with you. But weight loss is a major warning sign. You also need to check your liver. Sign number three, and this one is a bit more nonspecific, but I'm including it here because it's very common. Many studies report more than 80% of people diagnosed with liver cancer have this symptom here, which is exhaustion, tiredness, fatigue, nausea, and vomiting. It also feels like you wake up already tired. Why is that? It's not just because of the cancer itself, but also because cancer can affect your red blood cells, causing what we call anemia. That will make you feel even more tired. So, considering the whole situation, there are several reasons. Loss of appetite, too, as we've already seen, But signs like tiredness and decreased physical fitness, I'm not going to limit it here because it's already a non-specific symptom. So any of these. In these situations, it feels like you wake up already tired. Before, you could climb 4 flights of stairs. Now, man, you go up just one and you're already exhausted. So, a decrease in physical fitness is also an easy way to notice tiredness. Sometimes tiredness is more subjective, but a drop in your ability to do physical activities is clear. That's really noticeable, especially for those going through this. And sign number 4, this sign is also suggestive of changes in the liver, which is what's called water belly. In medical terms, we call it ascites. It's the buildup of fluid in the abdomen. And why can this be related to liver cancer? Why? When the liver starts to lose function, fluid can build up, not just in the belly, but also in the legs, also in the arms and face. I focused on the belly because that's the most noticeable sign, and sometimes even in the lungs. Fluid can also build up there, so water belly or ascites, depending on the region, a lot of people only know it as water belly. That's why I'm saying it this way. The point of this video is to share information, not to use a bunch of medical jargon. Do you agree with that? So this way it's easier for everyone to understand. But if ascites is present, you need to check how the liver is doing, especially its function, and how the blood proteins are, like albumin, basically how well the liver is working. Sign number 5 can also point to liver problems, pale stools, and dark urine. Pale stools? We call pale stools acholia and dark urine choluria. Why is that? Because this can also indicate a problem with the liver, especially with bile. Have you ever heard of bile? So you need to check how your liver is doing. It could indicate a liver disease, and one of those diseases could be liver cancer. This is a warning sign that's pretty easy to notice. Darker urine, many times patients don't worry much about it. But it can be dark urine, even the color of soda. So you really need to pay close attention, and lighter stools are usually the ones that scare people the most. And that can also be a sign of a liver problem. Sign number 6. Changes in blood clotting. One of the liver's functions is exactly to coordinate our blood clotting. If you have any liver issues, if it's lost function, you might have a higher chance of hemorrhaging or bleeding. So if you're bleeding more easily, if you got a small cut and it's bleeding, or you noticed a change in your usual pattern, or you have several bruises on your body and you don't even know how you got them. If you have bruises, that's a pretty clear sign. And in the more advanced stages of liver cancer, because the cancer can also produce substances that are procoagulant, you might have an increased risk of thrombosis, of blood clots. This can lead to a serious complication, which is deep vein thrombosis, clots in the deeper veins. And these clots can travel through the bloodstream and end up in one of the lungs, causing what we call a pulmonary embolism, which is also a very serious condition, pulmonary thromboembolism. That's what happens when there's a clot and it ends up in one of the lungs. It's a very serious condition with a high mortality rate, so you really need to pay attention to these liver issues. And sign number 7 is pain in the liver area. But where exactly is that area? It's called the right hypochondrium. It's in the upper part of the abdomen. On the right side, just below the ribs, at the lower edge of the ribs, it's easier for you to find it that way. That's where the liver is located. If you're feeling pain there, you also need to look into possible liver diseases. I'll explain that better too. I'll tell you how to investigate this, what the main tests are, but let's keep going with the signs and symptoms. And sign number 8 is jaundice, also known as amotilao, yellowing. You have an increase in bilirubin, and because of that, your skin can turn yellowish. Usually, this yellowing starts around the eyes. So it's really important to pay attention to the area around your eyes. Because lower levels won't cause yellowing of the skin, but they can already cause yellowing in the eyes. So, this can be a sign of a liver problem. And sign number 9 is itching. When bilirubin starts to increase, it can cause itching of the skin. About 20% of patients with liver cancer will have this sign, which is itching. The other signs, as a rule, are more common, but I included itching here because it's really striking. A lot of times, people don't connect skin itching with liver problems. Due to the increase in bilirubin, this can cause itching. When I used to work in hospital inpatient care and saw patients, many with liver cancer, this was really noticeable. Those who had increased bilirubin had itching, but a lot of times this itching is underestimated. Many people think it's caused by something else, but it really can be due to liver issues. And number 10, this one is much more common, which is abdominal bloating. You eat a little and it already feels like you're full, a sensation of fullness. Abdominal bloating is also called indigestion. Have you ever heard that term? So it's that feeling like you're full. You eat just a little. You already feel nauseous, your stomach feels bloated, you feel full. This also means you should check for liver problems. And sign number 11 is an enlarged liver, also known as hepatomegaly. An enlarged liver can be detected during a physical exam. Often, it's a clue that leads to a diagnosis because there might be a mass or a nodule, or the tumor could be growing. This can be felt during the physical exam. Now, what tests does the doctor use to identify a liver problem? There are blood tests, and we also have imaging tests. What are the blood tests? To see if the liver is being damaged or if it's inflamed, for example, there are liver enzymes like TGO and TGP. In some regions, these liver enzymes are called AST and ALT. It's the same thing. We also have liver function tests to see if the liver is working properly. Tests like prothrombin time to assess blood clotting, a complete blood count, and also paying attention to platelets because liver problems can lower platelet counts. Proteins in the blood, we can measure albumin and bilirubins. Did you notice I talked a lot about bilirubins? So, an increase in bilirubins can be a clue to liver problems. There are also imaging tests. What are these imaging tests? Here, the main one is the abdominal ultrasound, which looks at the liver area. This is the most common and frequent test, and it can give some really useful clues. Other tests, including abdominal MRI, are used to check liver issues. Often, it's more specific for the liver itself. But ultrasound is usually the starting point. Or the patient might get an abdominal CT scan or some other test. That ends up looking at the liver area, and that's how they find out through this test. Wow, that's really interesting. After blood tests and imaging exams are done, if the doctor is suspicious and wants to confirm the diagnosis, a biopsy is necessary. They remove a piece of that tissue and analyze it in the lab. It's important to highlight here that confirmation comes through this biopsy analysis. Through the exams, we have a strong suspicion, but it's only confirmed with a biopsy. It's important to mention that. I see a lot of patients who have a possible cancer diagnosis, and they even come in saying they have cancer. But when we do the biopsy evaluation, we find out it's actually something else. So the biopsy is essential, even for treatment. And why is this type of cancer increasing so much? There's a condition called fatty liver, and fatty liver can damage the liver, leading to fibrosis, scarring, cirrhosis, and it can increase the risk of liver cancer. And since fatty liver is increasing a lot, the latest estimate is over 1 billion. Just think, more than 1 billion people in the world. Some studies even say that number is much higher than that. So we have an increased risk of liver cancer. There are other factors too, like hepatitis C, hepatitis B, and smoking. Obesity is also a risk factor for increasing the risk of liver cancer. And since obesity is also on the rise, we're seeing an increase in this frequency. But why? We know that fatty tissue or adipose tissue is active. It's what we call metabolically active tissue. It can produce substances and cause inflammation in your body, which leads to an increased risk of liver cancer. So it's really important to take care of these risk factors I mentioned here. Many of them are preventable. You can lower your chances with lifestyle changes. Did you notice I talked about fatty liver? Do you want to know what the best foods are for fatty liver? And the worst ones, the ones you should avoid? I've already made a video just about that. If you're interested in prevention or in a more effective treatment using natural foods, I've already made a video on that with lots of tips about fatty liver. It's really important that you watch it. If you click here, you'll be taken straight to that video. Take care. See you next time.